Hey guys, welcome to our segment on hematology. I want to start out this lecture a little bit differently. This time, instead of having a video for you to watch and listen to, I'd like you to put on some earbuds and plug in to talk about the body in regards to blood and the blood-forming organs. Let's go ahead and get started. Hematology is the study of blood and blood-forming organs. It exemplifies the way that multiple organ systems interact and maintain homeostasis, right? The normal balance of body functions, maintaining balance. Hematologic disorders are common and include red blood cell disorders, white blood cell disorders, platelet disorders, and coagulation problems. A lot of these are things that we've discussed or will continue to discuss throughout this lesson in regards to the clotting cascade. Although these disorders are common, they rarely are the primary cause of a medical emergency. They usually accompany other ongoing disease processes, such as diabetes or other issues, things like renal failure or heart failure. Some hematologic diseases are genetic in origin, and so we have to kind of recognize that sometimes these things get passed on. Hemophilia A is a classic example of that. It is a sex-linked disease that causes abnormally low levels of essential blood clotting proteins, those factors that are important. And it affects approximately 1 or 2 persons per 10,000 in the United States, so it's still pretty rare, but not something we would never see in the field. Some hematologic diseases are more common in certain ethnic groups as well. For example, among the population as a whole, sickle cell anemia is relatively uncommon. However, among African Americans, specifically 8% of the population has the sickle cell trait. So that's important for us to recognize. In addition to their primary effects, hematologic disorders may predispose patients to infections and intolerances to exercise or hypoxia, acidosis, or even blood loss. So obviously, hematological disorders can affect any other underlying medical or traumatic emergencies. Now, patients with hematologic problems often complain of signs and symptoms that do not point directly to a specific disease process. It's hard for us to be able to determine what the problem is in the field when it comes to hematologic problems. Careful examination and history taking may be necessary to further clarify the diagnosis you're going for. Often, however, laboratory findings will be needed to confirm the diagnosis. Thus, the final diagnosis for the patient whom you're caring for and you provide pre-hospital care for is often not immediately apparent. So we're going to care for them as they present. You must use your assessment skills to recognize and treat injuries, pain, instabilities, while formulating a field impression that enables you to anticipate further complications and thus enhance your patient outcome and hopefully their survivability. And because of this, it's essential that you have a good understanding of the basic pathophysiological processes of your patient's diseases, including those of hematological disorders. So with that, let's go ahead and jump right on into our lesson on hematology.